This is kind of my mission, my educational mission to you in a nutshell. This is a triptych. It's a triptych of diptychs. It's a 3 of 2. It's a 3 pairs of images that show nature at her glory, and nature when it's not quite as beautiful, as harmonious, or as graceful as usual. I want you to reflect on how to prepare yourself for the cycles of nature. I want you to appreciate that you are a miracle of nature, and living in harmony with nature will give you a much happier and healthier life. So today we're going to talk about puddles in the tissues, the moisture overflowing the tissues rather than the moisture in the tissues giving rise to the brilliance and the fragrance and the beauty that you are. We're now into the season officially of springtime. And we want to know, well, am I going to be suffering from this? Or can I navigate the coming months? So with that, many of us will suffer summertime allergies. And we've talked about different layers of the immune system and the immune system protecting us from that which is outside, whether it is viruses and bacteria from this sort of thing. And well, we have Dr. Tom's great remedies that we can put in our home medicine cabinet. But when it comes to airborne allergies, what happens is these allergies come in and they invade the auric shield, our immunity that actually extends outside of our body as an intact electromagnetic shield. Ever walk into a space and you suddenly found or felt that you didn't like the energy of that space and you slowly walked backwards outside of it? That was a violation of your outermost sheath of your immunity. And if whatever that noxious entity is that's penetrating your auric shield, if it penetrates the layer of mucus that is in your nose, in your throat, in your lungs, in your GI tract, in your urogenital tract, it can incite an allergy. So I'm giving you a forewarning here that as we see more and more pollens blooming around us, whether it's flowers or trees or grasses, you will be assaulted. Your energetic first and second layer of your immunity, both energetic and biochemical, will be assaulted. Some of you have been experiencing this every spring for years and years and years, but it kind of passes. The winds come and the winds blow away the pollen, or they strip the flowers away, or they cleanse and they decrease your exposure, and you no longer suffer these deep penetrations. And isn't it curious that even though it may penetrate at one area of the body, there are other parts of your sheath that break down? Well, we know how to fight fire with fire. Coming out of World War II, where we were very good at fighting fire with fire, we invented a whole bunch of antihistamines. The problem was most of those made us really, really sleepy. And some of you all use those and use them quite frequently. And I've had some of you all walk in the last week or two telling me that you've been using those medicines practically daily for years and years and years. Well, blocking your immune system with an antihistamine on an ongoing daily basis is not smart. So using steroid or antihistamine creams on your skin, well, it will help if the whole problem is a passing affair. I gotta say, that's not the smartest thing to do. Well, some of you go, well, but how about foods? Well, we know that vitamin C will help with allergies. Vitamin C, vitamin D, zinc, right? Those 3 things. But if you have been suffering a lot of allergies, many of you will come to me and say, acidic foods like lemons actually make my allergies worse. I can't even squeeze my lemon into my water. My hands break out. Vacations are a good way of allergy control, but can we really do that? And can we relocate ourselves? And is that a smart thing to do? Is it feasible to do? Well, there is a solution, and especially if this solution has become chronic in you. And here's the screen to remember. It's called 3 little letters, LDA, Low Dose Antigen Therapy. This is a reversal of chronic allergic condition. There's something else that you can consider, and that's called allergy desensitization. And there's basically 2 types available to us that are first-line treatments. One is what we call neutralizing antibodies. So there's a second way of doing allergy desensitization, and this is what we call immune cell memory correction. Let's correct the memory of the immune system. And this is a T cell therapy. This is the skin about 15 or 20 minutes after low dose antigen therapy.
This is my allergy season right now, and my 3rd shot. I haven't had to take any allergy pills. My brain is clear. I don't feel any fogginess, just amazing high energy levels.
And Donna, how long did you have allergies for?
55 years.
Let's see that arm. Oh my goodness, what's going on there? Tell me, Donna.
So that's where the allergy shot is, and it's retraining the T cells. And the first time it was probably 3 times as big and really swollen, and each time it's gotten less and less. And my reaction to the airborne allergies have been significant. So it's been awesome.
If you want more information or you'd like to speak to me, just email my front desk staff, all one word, front desk staff at drtomyarema.com, and just put low dose antigen therapy in the subject line.